Now we will close this session. I think the last talk, pain management and DVT joint replacement. Dr. Anu. Oh, one more last talk is there. Yeah.
चेंज कैसे करना है? Respected chairpersons and distinguished guests, joint replacement surgeries are very commonly being performed nowadays, with more than 28,000 surgeries being performed in India alone in a year. But the patient's prime concern is post-operative pain. Pain cycle is a complex, poorly understood phenomena, most likely mediated by cellular, neural, and hormonal mechanisms. This is the pain pathway depicting the action of various drugs at different sites. Therefore, to have a comprehensive control over post-operative pain, a multimodal approach is required. Unrelieved pain may trigger various stress response and may even lead to various complications like myocardial infarction. Coming to preoperative pain management, preemptive analgesia is administration of pain-relieving drugs prior to onset of pain. This can be achieved by a combination of paracetamol, tramadol, pregabalin, and dermal patches. Regional anesthesia has an advantage over general anesthesia as far as post-operative pain management is concerned. Regional anesthesia can be administered via spinal, epidural, or a combination of spinal and epidural. During the intraoperative period, injection of a cocktail mixture into the periarticular space has been found effective in relieving post-operative pain. This cocktail mixture comprises of ropin 0.2%, tranexamic acid, and antibiotics. These are the various sites where periarticular injections have been found to be helpful. Post-operative pain management can be achieved by epidural top-ups, local nerve blocks, and patient-controlled analgesia. If there is an epidural catheter in situ, this is the best way to relieve post-operative pain. But there are certain difficulties in inserting the epidural catheter. Various nerve blocks like lumbar plexus block, femoral block, sciatic block, and obturator block are also helpful in post-operative pain management. Patient-controlled analgesia can be administered either via the intravenous route or via the epidural route. As the drug is administered by the patient himself, the lag between the onset of pain and the delivery of the drug is very much reduced. This shortens the pain cycle, and presence of lockout system also prevents medication errors. Patient-controlled anesthesia is helpful in various ways. Various surgical techniques, when adopted during surgery, referred to as reduced tissue trauma surgery, are also helpful in reducing pain. Post-operative use of opioids, NSAIDs, certain sedators and tranquilizers, transdermal patches, and various physical modalities like cryotherapy and TENS are also helpful in relieving pain. This is the protocol we follow here. Preemptive analgesia, followed by intraoperative cocktail regime, and post-operative use of an infusion pump. Now, we are so much concerned about post-operative pain, primarily because we want early mobilization of the patient so as to prevent yet another complication, that is DVT. DVT prophylaxis can be achieved mechanically by the use of compression stockings, intermittent pneumatic compression devices, or IVC filters, or pharmacological by the use of aspirin, warfarin, unfractionated heparin, and low molecular weight heparin. Now, coming to conclusion, improved perioperative pain management using multimodal approach have accelerated the rehabilitation of the patient, reduced the hospital stay with early return to work. Thank you.
Will felicitate, ma'am?
Yes, yes.
Felicitate.
May
I request Rajiv Raman sir to felicitate Anu ma'am.
Dr. Ravi Raman felicitate Dr. Anu ma'am.
Now, I would be the last speaker and the session will be closed today.
Okay,
Sir, before I start my talk, he is setting